The importance of mental well-being is at the forefront of public health. In recognition of Asian American and Pacific Islander Heritage Month, we're focusing on the challenges of mental health in the AAPI community and the efforts to address those needs. Joining me now is Chen. She's the Executive Director of the United Chinese Americans WAVES program, and it stands for Wellness, Advocacy, Voices, Education, Support. And Lily, we'll talk about WAVES in just a moment, but I wanted to first start with this statistic. The leading cause of death of Asian Americans 15 to 24 years old is suicide. And that is just heartbreaking. No other racial group has this as the leading cause. Why are so many young Asian Americans suffering?
Yeah, this is startling indeed. So most mental illness was diagnosed before 25 years old. And Asian Americans are no exception. But there are unique risk factors for AAPI community and especially youth. One is that the AAPI group is the least likely to get help, actually 3 times less likely than white. And then there are other risk factors. Obviously, biological factor is one, but unique factors such as identity and bullying, being bullied. And for example, one of my daughters was bullied through school for 10 years before she realized that that the effect on her mental health. Another daughter of mine, I have 5 children total, and stopped speaking Chinese altogether. And then she didn't know why, because she didn't want to be different until she went to college, taking Asian American studies, and she realized that the effect of microaggression and the comments about her identity has on the mental health.
And, well, you mentioned that Asian Americans are also less likely to seek help.
Yes.
What are some of those barriers as to why so many of them are not accessing help?
I'm so glad you asked these questions. There's a multitude of barriers. There are structural barriers, for example, the language barrier, and the barrier of not enough providers who have linguistic and cultural competency to provide the care for us, right? And there's this deep-rooted stigma in our culture that it considered as a shame, and so people try to
disgrace on the family.
That's right. You know, losing face. So that's why we don't talk about it, and even we have it, we don't want to get help, right? So, and then another thing is a historic trauma, intergenerational trauma. So, for example, we work with the Korean refugee communities. They were displaced because of war, and all that, you know, have a big effect on their mental health.
All of that takes a toll on mental health.
Yes.
You're part of this program called WAVES. Talk about what that collaborative health effort is and how it's helping Asian Americans.
Yeah, so what it is really, we create a safe space and then also opportunities to educate our community members and focus on youth. We have parent education, mental health first aid training. We make documentary films to elevate our voices, destigmatize mental health so that we normalize mental health. We also would like to extend our help to other ethnic groups as well.
Well, thank you for all the work that you're doing here. For more resources and for more on this, you can go to ucawaves.org. Lily Chen, thank you so much. Thanks for your insight.
Thank you so much for having me. It was my pleasure.